everyone, and thank you for joining us today. We are here as part of the Heart for PCOS campaign this February, which is connecting hearts and PCOS. And today we have a very special guest joining us, Dr. Felice Gersh, who I can't say enough about. I've known her for quite a while, and she is always a wealth of knowledge. So welcome, Dr. Gersh. Thank you for joining us this afternoon.
Well, thank you so much for the invitation and for putting this program together. Every woman, even without PCOS, needs to know all this material.
Absolutely. So can you tell everyone a little bit about your background and your connection to PCOS?
Sure. So I have a dual board certification in OBGYN and in the newer field of integrative medicine. I did the 2-year fellowship in integrative medicine at the University of Arizona School of Medicine, which I completed now over 10 years ago. So I just knew that we had to expand our therapeutic toolbox. Just pharmaceuticals and surgical procedures was not doing it for me or my patients. So I had to do what I call expand my therapeutic toolbox. So by going and doing the fellowship, I acquired knowledge concerning lots and lots of lifestyle medicine interventions, herbal medicines, nutrition, and I also did a deep dive into what we call now functional medicine, looking at not just sort of memorizing drug to this that we call pill to the ill, but rather looking at how things work in the body so that you can get down to fundamental root causes to not just cover up symptoms, which I'm not against dealing with symptoms, but to really optimize health, you have to do more. You have to get down to the nitty-gritty. Why is this happening? And then deal with it. So I just expanded in that way. And for myself, like many of the people who are involved in medical problems in their doctors, I have it myself. And I had to self-diagnose a long time ago. So I had what we would call the lean version. But back in the day, I had horrific acne. I was like having to deal, what the heck is with this hair? And I had infertility. I went 2 years without a period. So I just had to figure this out. You know how that is. There's nothing like self-motivation. And then, of course, I had to spread the wealth of knowledge around, right? So that I could help not just myself, like we put the oxygen mask on first yourself, but now, of course, to spread it throughout not just the US, but the world, to help women everywhere, because PCOS is a worldwide epidemic now.
Absolutely. It's up to 21% or approximately 1 in 5 worldwide, which is astounding. And it amazes me whenever I talk about those statistics that there are still so many people that don't know about it, don't understand it. And one of the things that I love that you just talked about is that with the type of practice that you're doing now with the integrative and the functional, that it's looking at the root causes and the whole person instead of the symptoms, because I think a lot of times practitioners get lost in that because they're focused on treating the symptoms instead of the whole person. So why is that important that we look at PCOS as a whole person, a whole body condition instead of treating the different symptoms?
Well, the reason I said in the beginning that every woman with or without PCOS needs to understand PCOS, because I say it's the poster child of a medical status where you're actually seeing the blend of fertility-related issues with metabolic issues. And I learned this early in my career. Of course, the whole body is involved in what? In supporting fertility, because whether we want to have babies or not, and we're the only species on this planet, us, Homo sapiens, that actually try to control our reproductive destiny, when you keep that in mind. But regardless, we need to understand how the body was evolved. And the prime directive of life is the creation of new life. And to that end, you need to have a healthy everything. I mean, literally everything. You can't just have someone who's ovulating. What about when they're pregnant? They need to have a healthy cardiovascular system. For example, when a woman is pregnant, what happens to her blood volume? It about doubles. So she needs to have a very special heart. And what happens also when a woman is pregnant? Her entire immune system has to be shifted so that it doesn't kill that alien little creature, the fetus inside of her. So we have massive changes. And what about the fact that when you're pregnant, going back to ancient times, you had to put on fat, You had to build up that little baby quickly. So there are mechanisms in pregnancy where women become sort of on the edge with insulin resistance. But when they're unhealthy metabolically and they get into a pregnancy, they can cross the line and then develop gestational diabetes. They can develop vascular problems and renal problems, and you name it, problems, right? So in order to be successful with reproduction, you have to have a functioning great neurological system, gastrointestinal system, musculoskeletal system, cardiovascular system, skin, and of course, immune system. You need everything working properly and optimally. Women with PCOS manifest issues, medical problems that span across every one of those systems. And this is not well recognized. That's why I was so excited to have this opportunity, because so often, like you said, if someone is a gynecologist, all they think about is, well, we're going to do whatever it takes to get you pregnant. We're going to trick your body into ovulating in an unhealthy body. Well, that's going to have implications for not just being successful with the fertility efforts, but also what happens to that pregnancy, what kind of complications, and what about the ultimate health of the baby? Because we now know that genes are modified in how they express themselves. We call that epigenetic modification if you have an unhealthy mom. So by understanding PCOS, you can really understand how the female body works. And when things go awry, as they do in PCOS, then you can start putting all the pieces together. You can't attack one part of this problem. And the good news is that when you do something, when you really understand what's going on and you start taking actions to help one thing, guess what? It's going, and you're not just tricking the body into doing something, but you're really helping the body to heal and become healthy. Then you're helping and restoring function in every organ system. So that's the beauty of it. So, but if you just attack one thing, like, oh, this person is overweight, so we're going to put them on a drug or starve them for 3 months, you're not restoring health. You're not getting to the underlying why, which is the whole functional medicine thing. And if you're only going to have 1 or 2 tools in your toolbox, you're not going to be able to expand your options to help each and every woman to be optimally healthy and fertile. And fertility is a vital sign of health, whether you want to have a baby or not. And we need to understand that the hormones that make you fertile make you healthy. When you get rid of those hormones, like oral contraceptives and other hormonal contraceptive mechanisms and devices and so on, you're getting rid of the normal, beautiful hormones and rhythms of a woman, and you're not really going to restore the health of that woman. And I call it kicking the can down the road. It's smoke and mirrors. It's like covering a wall full of mold with beautiful wallpaper. You're not restoring the function and status of that wall. You're just covering it up. And that's what we have to stop doing. We need to get down to the nitty-gritty, the fundamentals. What is going on in women with PCOS? Why is this epidemic exploding? And what are the different manifestations throughout the organ systems? And, we're going to focus on the cardiovascular system, but it relates to every system. That's like the key takeaway. You're not just dealing with one system, you're dealing with all of them. And we're going to try to work with every woman to optimize her health. And can we make everybody perfect? Probably not, but that's okay. We have an expression, don't let best be the enemy of better. So even if you can't be perfect, like who the heck is perfect, right? In this day and age or ever, right? But we can do so much besides the smoke and mirrors of just tricking women into getting pregnant and also, covering up the symptoms. We can do so much better.
You're absolutely right. And that's why we do Heart for PCOS, because while infertility and getting pregnant is so important to so many, and I completely understand that because I dealt with infertility myself, we have to recognize, as you said, that it is a whole body condition. And if we don't treat the entire body, then we're predisposed to things like cardiovascular disease, which is what we're here talking about, because there has been a lot of research coming out about the connection between PCOS and cardiovascular disease. A lot. However, many patients aren't aware of the risks and why it is important to be aware, even starting at young ages with PCOS. We're seeing women in their 20s and 30s who have plaque deposits building up in their arteries, which is crazy to me. So can you please give an overview of some of the connections between PCOS and cardiovascular disease?
Well, one of the things that needs to be sort of like, we'll call it the ground layer, the foundation of female health. And that is the hormone made by the ovaries during the reproductive years. It's a form of estrogen called estradiol. Now, a lot of people use the word estrogen and they use it incorrectly because estrogens are a family of hormone. There's not just one estrogen. The one that's made by the ovaries has a balanced effect on the different receptors. So all hormones work, at least largely, by binding to a receptor, kind of like they use as an analogy, a key into a lock. But the lock, in this case, in the human body, is not a fixed lock. It's more like Jim Carrey's mouth. It's like it can morph. It can be closed. It can be open a little, it could be wide open. So it's a dynamic structure, the receptors, and many different things can influence how they work. And the thing that's happening with women with PCOS is that their estradiol levels are not being produced in adequate amounts, which we'll touch on. And as well, they have now shown that in our world that we live in now, which is filled with pollution, plastics, pesticides, herbicides, heavy metals, all of these toxicants that we call them, many of them act as endocrine disruptors for estrogen, but not just for estrogen. They can also act as endocrine disruptors for progesterone, for testosterone, for aldosterone, for a variety of different hormones. With the most focus has been on estrogen endocrine disruptors, which are labeled xenoestrogens. So they're not really estrogens. And a lot of people get very mixed up and interchange these things. And, even like the estrogens that people get when they take oral contraceptives or patches and so on, rings, that doesn't go into the body in the same form as estradiol into the bloodstream that, the ovaries would produce. So it's really a different hormone. So it has different effect on the different receptors, creating an imbalance, because everyone knows you have to have a balance. Everyone talks about balance of this, balance of that. The Chinese got it so many thousands of years ago with the yin yang, right? So, and you need to have the balance. You don't have that if you don't have adequate amounts of estradiol coming from the ovaries. So we have a problem that is innate and probably somewhat genetically programmed. But what's happened is what is a little problem, or maybe not even a problem at all in ancient times, where women who had the innate genetic form of PCOS had just a slight elevation of testosterone and a slight reduction of estradiol to make them slightly less fertile, almost like a little built-in birth control, but they still were fertile and they were healthy. And some people think that those women, because they had a little extra testosterone, were sort of the leaders of the tribe. They were dynamic and strong and bold and brave, and so it was actually a plus. But if you fast forward these thousands of years to today, now you take what was maybe a mild problem. We're talking about production of estradiol. So the ovaries don't make it adequately. And so what happens is those women now, it's like exploded and become so much worse, probably in large measure because of these ubiquitous, ever-present endocrine disruptors. The one that's been studied the most is bisphenol A, BPA. And in my own practice, I haven't really seen too much published. I find that some of the worst case women with PCOS often have some difficulty with some of their detoxification pathways, because it's not just what gets into you, it's what you can get out of you. And so they bioaccumulate and have an overall higher toxic load. That's the expression that we use. And these chemicals are really toxic to the cardiometabolic system. In fact, they've been labeled not to do with PCOS at all, just as a general thing in our society, as diabesogens. They're chemicals that interfere with metabolic functions so that the people who have toxic loads of these, they are more prone to insulin resistance, diabetes, and obesity, because it turns out that estradiol, I call it the master of metabolic homeostasis. It is the hormone that is like the hormonal glue that helps reproductive functions to be linked with metabolic functions. So what is a metabolic function? It's the creation, distribution, utilization, storage of energy. And women with PCOS have a problem with all of the above, because it turns out that the energy factories of the body are called mitochondria, and they are in all the different cells of the body, and they burn the fuel, the sugars, the glucose, and the fats, the lipids, to create energy. But in order to do that, you have to have adequate amounts of estradiol. So women with PCOS can live in a sea of energy stores, also known as sugar and fat, right? They can live in a body that has all these energy stores, but they can't access it to create energy. So they're tired, they have fat, and this leads down the path to more problems, like a domino effect. So then we have altered states of the immune system, and every cell in the body, every organ system in the body has receptors for estradiol, and that's not well recognized. So every system, including the immune system, back in like 1998, a friend of mine at the University of Indiana discovered that immune cells of women with PCOS have a lower threshold to be triggered to create inflammation. So for example, if you have impaired gut barrier, also known as leaky gut, which now we know women with PCOS have pretty much universally, and that can lead to toxins, we call endotoxins, from inside the gut lumen inside, getting past the little junctions, the little cells, that because the inflammation causes breakdown of the little fibers that hold them together, they start drifting apart, and the abnormal microbial population in the gut creates these abnormal products called lipopolysaccharides, LPS, also known as endotoxins, which leak out, and 70% of the immune system lines the gut. We call it the gut-associated lymphoid tissue. And those immune cells of women with PCOS trigger inflammation like firecrackers going off at a much lower threshold. So you have like compounded upon compounded problem. Now, what's going on in the ovaries, and why do they have a problem making estradiol in the first place? Well, it turns out that there's a sequence of events. All estradiol in the ovary derives from its precursor, testosterone. And people with PCOS kind of know that women with PCOS of the type that we call the ovarian type of PCOS, which makes up probably about 80% of PCOS patients, where the source of the extra androgen, testosterone, is coming from the ovaries as opposed to the adrenals. Of course, sometimes it can be both. No one says you can only have one thing. And what happens is in the ovary, it's like a little assembly line. There's a hormone from the pituitary gland called LH, luteinizing hormone. And that is triggered to be produced because the brain sends out signals when it says, hey guys, I need more estrogen, make more estradiol. So the first step is to have the pituitary make LH, and that tells the ovary to make testosterone. Well, guess what? Testosterone production goes on fabulously. No impediment to that one. So the ovary of the women with PCOS make plenty of testosterone, different skill set, okay? Then the testosterone moves from one set of cells into a new set of cells called the granulosa cells, where under the effect of FSH, follicle stimulating hormone, it triggers the conversion through an enzyme that's called aromatase, converting testosterone into estradiol. And this process is not going well in women with PCOS. They do make it, as they make estradiol, but they don't make it as much or as efficiently. And so that's why we do things like we give myoinositol. It turns out that that works with a different enzyme, epimerase, that helps with improving the function of aromatase. And that other hormone that is also measured, Antimalarin hormone, AMH, that is shut down by the FSH. And so that's not happening. So I call AMH, antimalarin hormone, I say that name is crazy. Where does that name even come from? It comes from embryological times when certain structures would disappear, regress. But in an adult woman, what that hormone does is totally different. It's a follicle recruiting hormone. So it recruits the follicles. And if you don't have the off switch, it's like, in that fairy tale where the pot kept boiling over with porridge, there's no off switch, So because the off switch is the FSH, which isn't working properly and not being produced enough. So you keep recruiting follicle after follicle after follicle, but you don't have that special process called ovulation, which is triggered by the high LH, but you have to have FSH. So the thing is, but it also is triggered initially by a high spike of estradiol, which is linked to FSH. So the system is not functioning properly. So you get all these recruited follicles, you have high antimalarin hormone, you have all these little cysts, that's what we call the ring of pearls, and that's where the name PCOS, polycystic ovary syndrome, came from. And then we have a deficiency of estradiol and a surplus of testosterone because the brain has sensors and it says not enough estradiol. So it triggers higher production of LH and then higher production of testosterone, but you still don't make enough estradiol. So you now have compounding the problem, too much testosterone. When you have high levels of testosterone, it also alters the gut microbiome and triggers the gut to actually cause more testosterone. It's like, oh my gosh, insult to injury. So that actually causes more of that trigger. So, and why, are all these problems happening? Because estradiol, which you don't have enough of, and testosterone you have too much of, are critically important for cardiovascular health and function, because estradiol, remember, it's the master hormone. It not only causes mitochondria to work properly and keeps mitochondria from accumulating a toxic metabolic byproduct called superoxide, that you need to have a certain enzyme, manganese superoxide dismutase, to convert that. Ultimately down the line, it goes into turning into water. But if you don't have enough estradiol, you actually build up too much of this and it actually poisons the mitochondria. So it's like cumulative over time. And when you have all of this inflammation coming from the gut and the immune cells triggered to make all this inflammation, that in turn creates insulin resistance. And it turns out that estradiol is also critical for the function of what we call the GLUT transport system. That's the glucose transporter system that transports glucose from the blood into the cells. So you have multi-layers of problems here. That you can't transport sugar into the cells properly. You have growing inflammation, which then we now know that inflammation itself causes damage to artery walls. And then you have, high levels of sugar, which also cause more damage and affect nerves. So that can affect how the conduction system and the heart muscles themselves are working. So it's like layer upon layer. And there's an enzyme system in arteries. So many of the enzyme systems in the body are controlled by estrogen in the form of estradiol, including the production of sugar and fats and and cholesterol from the liver, including the picking up and getting rid of old cholesterol through what we call LDL receptors on the liver, preventing rancidity or oxidation of cholesterol by implementing and activating an enzyme called PON1 or peroxidase 1. There are so many enzyme systems that are all regulated through estradiol levels. In addition, you have this one that's called endothelial nitric oxide synthase, which leads to the production of a gas called nitric oxide, which is critical for maintaining platelets from clumping together and causing blood clots when you don't want them for no purpose. maintaining health of the artery walls, maintaining dilation so you don't have constriction of the arteries themselves, and also works in heart muscle itself and also in brain. And so, you have blood vessels that go to the brain, and some of them are called the blood-brain barrier. And you lose the healthy integrity, just like you do in the gut. So just like you get leaky gut, you get leaky arteries, and you can have toxins that are circulating, then get into the brain, causing neuroinflammation and further disrupting all kinds of things, including our circadian rhythm, which is all disrupted in women with PCOS. And there are estradiol receptors on the master clock, which is a group of neurons that sits atop the optic nerve in the hypothalamus and senses light and dark, and also nutrients. So this system goes awry, and women with PCOS are essentially dysregulated, living like they're in different time zones. So different organs, someone would be in San Francisco and other ones in London. This is not working. This is not proper synchronization. And also the nutrient sensors are controlled through estradiol. So women with PCOS tend to have appetite dysregulation, tending more towards binge eating disorder. And because they have circadian rhythm dysfunction, they often feel hungry and get the night munchies. And they're tired in the morning and they're dragging, and at night they feel suddenly more awake. They call themselves night owls, and then they start eating, which of course further dysregulates systems, including another one that's called the endocannabinoid system, that's also throughout the body. So the bottom line, the takeaway is, like, there's no test on this, but if you don't see at least the complexity, just that it's total body and that it's all linked to not like 20 different underlying problems. That's like, a lot of times, that people say, how can this woman have so many symptoms? Because she has inflammation, so she has joint pain and palpitations and sleep problems and mood problems and hypertension and high sugar and fertility problems, irregular cycles, and then she has acne and skin issues, and so you go down and every organ system is having a problem. And so if the doctor doesn't understand that it's all together, it's not separate, totally unique, unrelated issues. It's all part and parcel of the same process of inflammation, insulin resistance, which is driven by higher than what should be levels of endocrine disruptors and an innate disability or handicap to make estradiol. So what can we do? I mean, it sounds dismal when you say all these things, because women with PCOS have early onset, like you said, of cardiovascular disease, insulin resistance. And we now know when people have insulin resistance, higher levels of sugar, that further promotes damage to the artery walls. So to get plaque, there's two prerequisites. So this is really important to know. You need to have damaged arteries. You need to have like cracks and fissures in the lining, which we call the intima. And you need to have oxidation or like rancidity of cholesterol. Just having high cholesterol, there's no mechanism for cholesterol to just jump into artery walls. It's a process that must involve inflammation, oxidation of cholesterol. And then what happens when you have rancid cholesterol, we call it oxidized cholesterol, often oxidized LDL, is that these pieces of cholesterol, and cholesterol does not travel around the body by itself. It needs like little carrier proteins. I think of them as little envelopes, and then it's like a mailing system and they go different places, And so some of the cholesterol has to come back to the liver for elimination. Okay, and that's the little particles are called apolipoprotein A1. In order to make that, you need to actually have estradiol. In order for it to dock like a spaceship docking, on a planet, you need to have proper receptors on the liver. And those don't work properly in a shortage of estradiol. And if you oxidize the cholesterol, they're no longer recognized even by the receptors. So this is damaged tissue. The immune cells of the body pick up dead and dying cells. That's what the scavengers do, the phages, the macrophages. So they gobble up this oxidized cholesterol that's circulating in the blood, and they're attracted to two things, these macrophages: damaged tissue, which is what the oxidized cholesterol is, and pathogens like bacteria, viruses. Now, what happens if you have damage in your artery wall because the lining, the intima, has cracks and fissures? Well, those macrophages are attracted to go there too. So they actually full of this oxidized cholesterol. So they look funny. They look like they're full of foam. So they actually call them foam cells now. They work their way through the cracks and fissures of the inner lining of the artery into the wall of the artery, where they get stuck and create more inflammation and put out little signals called chemokines that call in more and more immune cells to create this inflammatory reaction where you have this like yucky, like waxy material from this old yucky oxidized cholesterol building up. And that's the beginning of the fatty streak, or the beginning of atherosclerosis and plaque. And if you have ongoing damage, ongoing oxidation of your cholesterol, that plaque can grow and grow. And if it becomes very inflamed and unstable, that's when it can rupture. And that can lead to a little blood clot, like little scab forming on the inside where the blood is flowing. And if it breaks off and goes downstream, it'll get stuck somewhere, and that will be a heart attack or a stroke. So this is what we absolutely don't want to happen to anyone. Plus, when you have the damage in the artery wall, it also becomes stiffer, less flexible. You're more prone to hypertension, which is not an early stage problem. When a woman, by the time she has high blood pressure, it means she has significant vascular disease. So that's why, like you said, it just spot on. You got to get on this early. We now know that you can actually detect, or certainly be very suspicious of PCOS in little girls, like 6, 7-year-olds, and look at the family history. It's a pediatric condition, and the pediatricians are like totally like unaware of what they should be doing, to help these little girls so that they don't manifest with the worst, outcomes with this problem. And we can, like, I'm an MD, so I can do all the lifestyle stuff, and I can give supplements, and I have all of this like planned out in my books and my protocols and so on. But as an MD, I can also like measure estradiol levels, and I can actually see that they're low. And so I will actually supplement with bioidentical hormones, just like I would for a menopausal woman. The etiology is totally different, but yet the manifestations are so similar. If you look at the metabolic problems that women have after menopause, and you look at the metabolic problems that women with PCOS face, they're really the same. And women with PCOS have like an accelerated aging process. I think of PCOS as accelerated aging. There, of course, the difference is that after menopause, women make 0 estradiol eventually from their ovaries. Women with PCOS just make less. And then they have that added problem of all that testosterone. So they're not like identicals, but they have similar problems metabolically. And they both have, as a big part of their underlying situation, is not having enough estradiol. So in women in menopause, I give them hormone replacement therapy all the time. Women with PCOS are typically given what? Birth control pills, which are not human hormones. We don't give birth control pills to women who've had previous strokes, blood clots, smokers, right? So why are we giving them to women with PCOS when they have inherent increased risk for all the same metabolic complications that women who smoke or have previous events have? So it's illogical. But I can give women real human estradiol and progesterone, and I look at it as a stepping stone, a tool. So it's kind of like this thing. You can't heal until you have the hormones. And until you heal, you won't make the hormones. So I can give the hormones to facilitate healing. And then when things are good, they're like training wheels. I can take them away. So we can actually transition and like take all the women with PCOS back to their prehistoric roots, where they don't have such horrific manifestations affecting every aspect of their life. And, once you really understand, women with PCOS have unhealthy arteries, insulin resistance, systemic inflammation, and they have too much testosterone, which fuels the fire. They don't have enough estradiol, which actually is like the sort of peacemaker throughout the body and keeps everything like copacetic and homeostatic. But we can do so much. But it's not with smoke and mirrors. It's not with birth control pills, and there are published studies showing that women who go on birth control pills, for example, do have higher rates of blood clots. Blood clots are part of the inflammatory response of the body. Okay, so it's not like randomness that birth control pills increase blood clots, because it has the wrong estrogen in it. It gets estrone into the bloodstream. Estrone works on the alpha receptor, which is the dominant one on the innate immune cells, and becomes more of a pro-inflammatory effect. And so we do not want that to happen. We don't want this state of chronic inflammation. We have to have, everything sort of in balance. And, different organ systems of the body have different predominance of different types of receptors. And we're still learning more and more. There are also these complex membrane receptors, and the alpha and beta receptor actually interact with one another. So it's like just amazing what happens. And understanding that pregnancy is a very high risk situation for women with PCOS, and no woman should be tricked into getting pregnant by an IVF center or infertility center until she gets as optimally healthy as possible, because you're asking for trouble. I hate to say that, but the babies are coming out unhealthy. And by the way, talk about metformin. That is the go-to. There's a lot of problems with metformin. It is technically, and this is in the literature, you can just Google it, it's an endocrine disruptor. And it's given to women who are pregnant all through their pregnancy with women who have PCOS. And it doesn't, facilitate better outcomes. That's the crazy thing. And what does it do? It actually modifies the genes expressing themselves in the baby, so that by age 4, the baby of the women, compared to the control group that are matched, they're very similar, but they didn't go on metformin. Those children, the offspring, have metabolic dysfunction and have more body fat than the babies who did not come from a metformin environment. Plus, metformin does not get transformed by the body. It leaves the body exactly as it went in, as metformin. It goes into lakes and rivers, and it's destroying our wildlife, and it's getting into our drinking water. So I work with environmental medicine groups, and this is a huge problem that's not even recognized, because so many people are touting, oh, I love metformin, it's the anti-aging. Well, I know how to do age management. There's no such thing as anti-aging, right? But age management through lifestyle, nutrition, and managing hormones, rather than giving an endocrine disruptor drug that's poisoning our environment. So there's my little spiel on metformin.
I love it. And there are many other reasons why I personally don't like metformin. I was put on it, and it was one of the most horrific experiences for me. Now, with saying that, I know a lot of people do swear by it and say it helps, but when my body started responding with IBS symptoms and everything else, I realized that this was not the medication for me.
It's not great. And the newest thing that's like trending now are the GLP-1 agonists.
Yes.
Like Wegovy is the one that's for weight loss, and so on. So it's semaglutide is the generic name, semaglutide. So guess what? Estradiol increases the production of GLP-1 naturally. Yes.
Wow.
What else increases GLP-1 naturally? Exercise, intermittent fasting, fiber in the diet, like really healthy kinds of fiber, and estradiol. So you can spend $2,000 a month on a GLP-1 agonist with no exit strategy. You need to know that. Like, there's no plan for how to get off this drug ever. I mean, ever. And you can't be on it if you're pregnant, but this is incredibly expensive, and it does have side effects. And it's not like every drug. Of course, it has an array of side effects, and it can cause weight loss that in some is quite significant, but not in everyone. It's not like universally successful. Some people, I've had many patients who really begged me for it. So, okay, we'll give it a try, but I'm not going to let you use it forever. I mean, that's not my strategy. But a lot of them couldn't tolerate much. I couldn't even get off the lowest dose. It was making them feel nauseated and sick. So you never know. That's why you have to work your way up and hope like you get tolerance, just like with metformin. You wouldn't start at a super high dose right out the gate either. But this drug offers hope. I'm not against pharmaceuticals. I'm not alternative medicine, but I always look at what's the mechanism. How can we trigger that mechanism naturally so that we can be naturally healthy, not reliant on a drug with potential side effects, incredible cost, and no exit strategy for the rest of your life? So, these are like really important things to be aware of. I almost always have an alternative to these kinds of things for people who are game to really do everything to optimize their health. And honestly, I have seen dramatic weight loss, fertility. I mean, this is not like pie in the sky dreaming. This is like real hardcore results. And you'll never be cured of PCOS. What we're looking for is control. We have many conditions in the body that we try to control, and we can control it beautifully, and we can prevent early onset of cardiovascular disease, hypertension, heart attack, stroke. So this is what I say to my patients. You get the warranty ends at 100, but let's get you event-free, healthy, happy, functional till 100, and then we'll take it from there.
I love that. I love all these messages, and I love that you're kind of challenging perceptions about what we think PCOS is, what we think happens because of PCOS, and how we treat PCOS. Because there is no one set treatment that's perfect. There is no real answer as to what it causes it, where we're going with it. So having, as you said, your toolkit with all of these resources and being able to look outside the box is wonderful. So I would love everyone to know how they can connect with you if they want to learn more, if they want to sign up and work with you, just because
Sure.
you're amazing and you always have such profound knowledge, and I think it needs to be shared. So how do we get in touch with you, Dr. Gersh?
Well, I am an old-fashioned doctor. I do one-on-one doctor-patient care. We talked about in the beginning, I'm actually in an exam room right now in my office. So I see patients every day. And I have an office in Southern California, Irvine, and it's called Integrative Medical Group of Irvine. And for people who live out of state, then I need to see them, but not too often, like maybe once, twice a year. And I'm in a beautiful resort area, so it's not that bad. The problem is it is hard. I totally understand. It is really hard finding doctors who don't want to just sort of reflexively give birth control pills and metformin and spironolactone, which has its own issues. We could another day, another time, talk about how spironolactone works and how it really is part of interfering with the pro-inflammatory pathway. So it's really an interesting drug in itself, but a teratogen, because it can cause birth defects. I see patients all the time. You can come and see me and do some telemedicine first to see what you want to do. And as far as on the internet, I do Instagram lives, and I have my own Instagram channel too. And I have a YouTube where I archive things. And I also have books on PCOS. I have two. My foundational book, which has hundreds of references, is PCOS SOS. And then the second one for women who I want to get pregnant now, it's called PCOS SOS Fertility Fast Track. And that's a 12-week, week-by-week program, very clear cut of what to do in short order to optimize your fertility in a very healthy way, not tricking the body, but really restoring the body first.
I love it. Thank you so much for joining us and for expanding our knowledge on PCOS and cardiovascular disease. And hope to see you joining us again soon for more information and education for patients and providers alike. Everyone, thank you for joining us for this session with Dr. Felice Gersh. And be sure to check out Heart for PCOS for more of our live series, our pre-recorded videos, and our live events coming up in February. Have a great day.